Interventional radiology, according to experts, is a discipline of medicine that uses machines to diagnose and treat diseases without opening up a patient like in normal surgery, commonly referred to as minimally invasive therapies. This 2018 annual scientific conference is the first of its kind in the commercial and radiology hub of West Africa, Lagos. Latest development in this field, as discussed by experts, brings hope for patients with fibroid, cancer, and many other health challenges.
Let there be a national center of interventional radiology that will serve as a rallying point in which all the major cases in interventional radiology in Nigeria will be referred to. We are advocating for each geopolitical zone. Let the government choose one major teaching hospital and start one center there. And the state governments too, they should help by establishing this type of centers in their own states. And this is what is going to help our own society, our own patients. It will reduce medical tourism and it will improve healthcare delivery to the patients. And globally, the trend now is moving from communicable diseases to non-communicable diseases. We have diabetes, we have hypertension, we have cancer. They are all non-communicable diseases, and interventional radiology have a major role in treating diabetics because they come with blocked blood vessels. It's only interventional radiology that will effectively and easily treat that blockage. The hypertensives come with a lot of brain hemorrhages, a lot of rupture of vessels. You use interventional radiology to treat it. Look at stroke now. How many patients do we have with stroke in Nigeria? It's alarming, the rate at which we have stroke. As I'm talking to you now, the whole of this country, there is no center that can treat stroke with the current mode of treatment globally. We used to take catheters right into where the clot is formed. We retrieve it, clot retrieval. Or where there is bleeding, we go and block the bleeding intracranial within the brain. But what do? We do only medical treatment that is traditional. So it's multifaceted. Interventional radiology have touched virtually every field of medicine. And this is the trend and this is the modern thing. Nigeria cannot afford not to join this wagon. Otherwise, if we don't join, the wagon will go and leave us. About 20 to 25% of Nigerian women in the reproductive age are suffering from uterine fibroids. The common way of treating it here, as of now, is by removing the womb, that is hysterectomy, or doing a major operation that is called myomectomy. In interventional radiology, we go in with our image guidance and guide wires and catheters. We go and treat it without opening the patient. In fact, we don't even admit the patient for a day. We just observe the patient and the patient goes back to the work and the fibroid is treated. And there are many other diseases, including cancers.
Interventional radiology does not actually replace surgery, but it's a minimally invasive procedure, medical procedure in which rather than do surgery, you can at least do minimal treatment or therapy, which probably is not as costly as surgery. It's cheaper, it's economical. Breaking it down to what it will benefit the average Nigerian is that healthcare will be little bit economical. There's cost effectiveness. Rather than go for surgery, you can do a procedure that won't cost you much. Secondly, in terms of complications of surgery and all that, those ones are also removed. So the patient comes into the hospital, does the procedure, and goes home also immediately. Unlike surgery, where you have to admit the patient, right? Goes for the surgery, and then you follow aftercare of the surgery, is admitted and all that, okay? So the other thing is going to happen in future is that you do not actually need hospitals with so many bed admissions again.
It is about how do you use imaging, X-ray, which has been around for many years, to provide information to doctors to be able to not only diagnose but intervene. Some people you see have fibroids, and you see that we need to be able to embolize it. Embolization is the process of being able to make it smaller and allowing the tissues to breathe. Now, these doctors are specialist doctors that are able to do that. Now, interventional radiology is important in our country because, as you see, there are a lot of diagnostic centers and people are now being diagnosed and they know what's going on. But the challenge is that because this technology does not exist in country, people are they're going abroad for medical tourism. So if we can get radiology centers in our country that have interventional radiology and train more interventional radiologists, we're able to keep those patients in country and give a better prognosis and get better outcomes.
And one of the ways that we have advocated moving forward is that by getting reliable investors in healthcare so that the machineries that are required for this interventional radiology can be made available so that the doctors, we have the manpower, because Nigeria has more than 40,000 doctors working in US, in Germany, in other countries, and Nigeria gives India almost $80 billion in medical tourism.
They also called for enabling policies to promote public-private partnership in healthcare, increased budgetary allocation, and a compulsory health insurance scheme.